course, we've only got not much time left. So we will address some of that later. We are going to do a bit of a tutorial here. We're going to talk about burns as well. This is Burns Week. Your lecture isn't until Friday, and I'm going to be confirming a lot of different stuff on Friday about it. But we do need to start getting over some really important aspects of burns treatment today. So, we're on. High distance guys. Like you better than these guys.
Like a speech.
Huh? Right. And that's why. Righto. So, looking at burns, okay, we're going to go through and we're going to talk about treatment, and we're going to have a bit of a look at a case study. So this is a house fire. Everyone can see that house fire? Yes. Okay. Number one, what is your priority?
Safety.
Thank you. This is not a nightclub where you go running straight into. Absolutely. You need to look after your safety first. Who's going to make this scene safe for you?
Fires.
Absolutely. Who's in charge of this scene?
Fires. Everyone? Police, fires, and
That's two answers.
The manager of one department.
Of which department?
I don't know
Anyone want to take a guess?
police.
Thank you. Absolutely. The police are in charge. What will the police tell you? Go and talk to the fires. Absolutely. They'll be in charge of the whole lot. Is everyone happy with that? Okay. So, anyway, we're going to get tasked to this job. Who are we there for?
Patients. Everyone.
And also like the fireys as well, in case one of them get injured.
Not also, but especially. We are there for our brothers and sisters in arms who are in BA gear going and fighting this little incident here. Every time they go in and every time they go out, we need to make sure that they're right to go in again. Okay, we are there for the fireys. Now, we may get a patient on the way, absolutely, but any time there's a house fire, structural fire, anything like that, any time the fire brigade are tasked, an ambulance is also tasked with it. Can I suggest if you can get onto those jobs, especially when you're talking about metro places, best jobs ever, because you just park up somewhere near where the catering truck is. You'll have a great day. Won't do much work, but again, my vintage, that's a great day. Righto. Anyway, I'm going to chat to you about this on Friday when we go through our lecture. But importantly here, burns are rated number 1 on their depth and then number 2 on their size. And that's how we classify burns, okay? So we'll have a good chat about this again on Friday, but until then, we'll move on. So here, disregard everything that's written on the left-hand side there. I want you to look at this patient for me. Have a good look. There's 2 things that really worry me about this guy, okay? And it's the patient. It's got nothing to do with anything around him. It's got nothing to do with anything on him. 2 things that worry me about that patient. What are they?
Still close to the fire.
Not worried?
His age.
What about his lips?
From what I can see, there's a lot of glare, but they look like really pink, so they might be burned.
Possibly.
But his age, like, what his age?
His age doesn't worry me, but it's certainly I'm tipping him sort of 2 to 3 years old, thereabouts.
Doesn't have experience with you.
No, that could be in front of the picture or something like that. Got nothing to do with anything like that.
He looks pale.
Yeah, I can-
That could be his normal look.
His lips around his eyes are pink.
Okay, so I'll tell you, number 1, this would be a stressful environment. You saw the house, didn't we? Okay, he's coming out of that house. He's now somewhere near that. Very, very stressful environment. Young kid. We have noted it on his own. And what can you see? He's not crying. He's quiet. You can see that, can't you? Quiet patient is a patient to worry about. Number 1. Number 2, his lips may be pink and all that sort of stuff. Sometimes it's tough to work out whether or not that's normal or not. But what I can see is his mouth's open. And that worries me. Why? All gone for that run before? Yeah? Okay, I know when I go for a run, I start off for the first kilometre and And off I go, striding through, having a great time. On the way back, and the heart attack's about to come on, but when you're really struggling for breath, what happens to your mouth? Open, and you're starving for air. Oxygen, so you try and drag more in. So the fact that he's not crying and the fact that his mouth's open is two things that really worry me about this guy. Okay? Just a bit of a tip when we're giving you clinical prompts. That's the sort of stuff that we're really talking about. Now, numbers. Look at his numbers. He's got a respiratory rate of 40, saturating at 100%, and a heart rate of 155. Do those numbers worry anyone?
Yeah.
Yes.
Why?
Because it's compensated. And also the 100%, it shouldn't be that high, so it could be carbon dioxide.
Could be, but having said that, he's a pretty young new vintage. So,
And you what?
a new vintage. I mean, he hasn't been a smoker for 20 years. So, to be honest, 100% saturations are quite likely. Okay. Does the respiratory rate of 40 worry anyone?
Yes.
Yes.
Why?
Is he getting full breaths in, or is it just shallow and fast?
Don't know. My first question back to you, if we're calling this a 2 to 3 year old, what should the respiratory rate be?
Gold 20.
30.
Be worth knowing though, wouldn't it? Yeah. Somewhat high. It's probably on the top range of high, but not too worried. Heart rate of 155. Same. What should be the range that we're looking for in his age?
70 to 110.
Anyone else?
Up to 130.
I suppose point being, probably worth knowing, isn't it? Now, having said all that, we're not going to test you on any of that coming. But when you are talking about paediatrics, you do need to know what normal is for that range. Having said that, 155 is too quick for anyone. Okay. Anyway, so here he is. Treatment. Okay. So, priorities in our burns treatment. It's really hard sometimes to work out which way around this goes, whether or not you need to remove the source or do an ABC assessment. But either, like obviously if the burn is flames, then you would probably go and try and remove them from the source first, yeah? Otherwise there is no ABC. But maybe if it's a chemical burn, you might want to assess ABC first. Assessing the airway. Why do we need to assess the airway in a burns patient?
For an airway?
So they've got a burn airway, they're dead pretty quick. Don't have a lot of time to work. So whether or not that's smoke inhalation or whether that's chemical burns or whether it's actually flames that have gone down the gullet, if the airways start swelling, they're going to occlude, aren't they? Occlude, you're bugging. You don't have a lot of time. What does this patient need?
Intubation?
Absolutely, they need that little plastic tube down their throat so it can swell as much as it wants, but the plastic tube's going to hold the airway open into their lungs. Absolutely. But we need to be able to recognise this. How do you recognise an airway burn?
A hoarse voice.
Hoarse voice, that's certainly one way.
Coughing?
They've got singed hairs.
Coughing, absolutely. Yeah. So if someone's got a beard and they don't all of a sudden, yep.
Burns to the face?
Burns to the face, yep. Absolutely.
Ash around the mouth.
Huh?
Sudden ash around the mouth.
Absolutely. Yep.
Inspection inside now.
Yep.
Larynx stridor.
Absolutely. So if I go over to my little one that I prepared earlier, this is a mnemonic, and I know we love mnemonics in ambulance. This is one that we came up with New South Wales. Well, when I say we, they came up with and taught me many, many years ago. The old HISC. So a hoarse voice, inspiratory stridor, singed nasal or facial hair, cough. The final one down at the bottom, carbonaceous material around the face or mouth. Yeah. They just wanted to start with C. You know how we do mnemonics, we come up with these funny words to make it sound great. Absolutely. So we need to assess make sure we have a patent airway. If we have any of these signs, then this becomes a very urgent job. This patient needs to go to preferably a burns hospital. Second would be a major trauma hospital, or third would be a trauma preferred hospital, in that order. So for us, Royal North Shore, John Hunter, or Port Macquarie, if that was the option that we could take. But they do need to get there reasonably quickly. Is everyone happy with that? I'm going to give you a moment to write down my HISC. It's a good HISC. Righto. So our patient does not have airway involvement. That's good news, isn't it? It's a burn on their arm. What do we need to do?
Cool it off.
Cool it off?
Burning.
Excellent. How are we going to do that?
Room temperature water.
For how long?
Until it feels cool. I feel like depending on the severity of the burn too, you can put blood wrap on it to hold the heat in.
Yeah, so basically what I want to do is I want to talk, this is someone's target, and again this will hit your lecture slides the other day. But basically what this does is illustrates what happens inside a burn. So you have 3 zones from a burn, and the inner zone is called the zone of coagulation. Basically that's where the burn is at its hottest, and that is irretrievably damaged. Can't fix it, yeah? Okay. That's where it's hottest, and it's burning from there out. Now, your zone of stasis in the blue, I changed colours for you, in the blue there, that's potentially salvageable tissue, provided that it's resuscitated properly. Okay, so how you need to think about, and then you have your zone of hyperemia. So this is going to be the red area, because basically all the inflammatory mediators are going absolutely nuts at this stage, sending out shit everywhere, and so a heap of red blood cells are going to coagulate into that area, and that's where your inflammation comes from. Your red comes from as well. Probably won't scar. Okay, so what you're trying to do is put that fire out, and that's what you've got to think about. And how do you do that? Cool water, 20 minutes. Cool running water, 20 minutes. So there's no airway involvement. Remove the source. So this is a chemical burn, maybe brush it off or whatever. Cool running water for 20 minutes. Okay, set the timer for it. And we're told after that, the research is telling us that the majority of burns will be put out by then. Okay, that's cool. Now, we have a few complications with burns. One is going to be hypothermia. 2 is going to be hypovolemia, and 3 is going to be infection. So this patient can turn septic within days, and it's often the complication that kills people after burns is being septic because of infection. So after you've cooled your patient down, you need to get a sterile sheet and pull it out of its packaging because it'll be plastic wrapped, sterile sheet, and pat them down dry so that they're nice and dry. But just remember, infection is the problem. Now, our treatments here, number 1, was to put this person with a skin burn. So we've taken away their skin, so they now reduced their ability to thermoregulate because there's no skin there. So then we put them in cold water, which is going to make them cold. We need to give them heaps of fluid as well. I'm going to chat about that in a minute. But in ambulance, we don't warm our fluids, they're just cold. The treatment's going to cool this patient down more. Everything we do is going to make this patient cold. So we need to manage that to start with. So what you would do after you patted this person down with a sterile sheet, you would throw that away because it's no longer sterile. You go to your ambulance stretcher and you would put down a blanket with the sides rolled over. You put down a space blanket with the sides rolled over. You might put another blanket down as well, sides over the side. Then you would put your sterile sheet down on top of that. You would lay your patient on the sterile sheet. You would cocoon them in the sheet apart from one arm, which needs a cannula in it, and so we can get some access. So that'll stay out. they'd get cocooned in that sheet. Then the space blanket, and then the blanket over the top of it, and all that rolls so you keep it nice and warm. Okay? It's really important to make sure you keep this patient warm. Talking about fluid replacement, why that becomes important, as you can imagine, all the fluid around here just got burnt away, didn't it? Sort of, you can imagine a little campfire. You throw the bucket of water on, it's all going out it goes. So the body has lost a heap of fluid, so it's sending fluid over there to repair itself as well. So there's this massive fluid shift to try and go and fix the problem as well. As it gets closer to the fire, it just steams away. So there is a massive requirement to put in a lot of fluid to this patient to make sure that we do resuscitate them, fluid resuscitate. So, how do we work out how to do that? You might turn to me and say, well, it's not really important for us because we don't cannulate. And in return, I would say to you, it's important if you'd like to do well on your exam. I looked. So, to work out how much fluid you need to give, you need to understand what Parkland's formula is. Who is Parkland's? Well, you'll probably think he's going to be a bit of a fuckwit because he's making you do maths. He came up with this formula, or her, who knows. Anyway, so basically, what you need to do at the formula is 4 times the patient's weight times the percentage burn surface area will give you the total fluid this patient needs over 24 hours. However, they get the half of this in the first 8 hours, and then they get the remaining half in the remaining 16 hours after that. And what you'll need to be able to do is work out how much fluid they will require every hour. And then next semester, when you come back to us, we'll ask you to work out what the drip rate is. But for this semester, that's all we need to know. Now, you might turn around and say to me, I don't like maths, I can't do maths. And that's cool. You're wasting your time here at uni. As you may or may not have heard, many of our third year students went down to Sydney to apply for jobs with New South Wales Ambulance. And there was a test. And guess what featured heavily on that test? Maths. And if they failed the first time, some of them were given the opportunity to come back and sit it again. But if you failed on the second time, yeah, we don't need you. If New South Wales Ambulance is doing it, do you think the other ambulance services are probably doing it? Okay. So well might you turn around and say, I can't do maths, and you can be that person if you want to. I would suggest you spend a bit of time changing yourself from being that person, or making a really good choice about not wasting the next 2 years of your life. Can't do maths, you're not going to get a job as a paramedic. Cool? Righto. That's not my choice. I wouldn't give you a job either, but it's not my choice. That's a 30%. Right, okay. Is everyone happy with this? Let's do an example. Prove to me that you understand what's going on. I have a 100 kilo person with a 20% burn. Now what I would suggest to you, especially if you're not good at maths, don't do shortcuts, write everything out. And I would almost write pretty well everything that I've got there for you. The more you write, the easier it's going to be. Now I will tell you this in the exam. If you just come up with that answer, you'll be lucky to get marked at all. Okay? If you don't show you're working on your piece of paper, your mark will be 0 regardless of whether it's right or wrong. If this was a 5-mark question and you did all that right and got that wrong, you'd probably still get 4 marks. Okay? So you know that ambulance lazy thing that we like to do? Stop it! No lazy. Right, so as you work your way through there, so if I substitute everything, it's 4 times 100 times 20, which gives me 8,000 mil total. The first half is 4,000 mil, and I'll give that in the first 8 hours. I want to know how much I give every hour, so I divide 4,000 by 8, which gives me an answer of 500 mils per hour. Now I know that's what's for the first, so that's for the first 8 hours. So for the remaining 16 hours, because I worked at 8 times 2 is 16, I can also work out that half of that will be for the remaining 16 hours. Is everyone happy with that? Don't be afraid, again, exam technique, don't be afraid to underline your answers. Make life easy for the person who's marking your paper. Just remember, your paper, you are one of 260 students in your cohort. So the person who goes and marks your question could be up to the 260th time that they actually look at it. If you looked at something 260 times and you had to search, would you? Nice little question to ask yourselves, isn't it? And make it easy for the person who's marking your paper. Righto, is everyone good with that? Can everyone understand that? Righto, so prove it to me. You have a 50 kilo patient with 40% burn surface area. I'll give you a couple of minutes. And then we'll work out what the answer is.
Sorry, Tony, was that 40%?
Yep. 50 kilos, 40%. That's what I was trying to bowl your head.
You back
I think it was you who called me Johnny Howard, wasn't it? I remember that. Now what I will say is if you are struggling with this sort of stuff, if you sit and struggle on your own, then hey, you'll probably get the result you deserve. If you are having trouble, chat to friends, chat to me, whatever. We'll help you through it, but you do need to work on this sort of stuff. I'm just going to give you another minute. Righto, has anyone got the courage to spit out their answer?
Yeah, it's the same as the last
Same,
one.
yeah.
It is, isn't it?
Yeah.
Absolutely, well done for working it out. Absolutely. Righto. So if you think we're really cool, 80 kilo patient, 30% burn surface area. How much per hour do they get for the first 8 hours? Because realistically, it's the first 8 hours that worry us. If we have a patient in the second 24-hour period, or the second part of the 24-hour period, something's really gone wrong, hasn't it?
Wait, what was it? 80 kilos.
80 kilo patient, 30% burn surface area. Huh?
Can you write that for the distance people, please?
Can I write it for the distance
Yes,
people?
please.
No, they'll have this. They'll be
Oh,
right.
they will?
Yeah.
Okay,
Yeah.
never
Yeah.
mind.
Yeah. Look on your notes, people. Alright, keep going well. I'm gonna, in a minute, we're gonna search for answers. Time must be ticking on. Tick, tick, tick tock. Righto, who'd like to tell me per hour, first 8 hours, how much do they need? 600 mil, absolutely. Righto, I'll leave the rest of you to have a bit of a play with that as you like. Absolutely, and I'm going to flip back the screens. I'm going to give you some more examples that we can do later on, and I'll pop the answers up within the next day or so on the page. Now, you may have seen these sorts of burns dressings around prior. So these ones are well and truly out of date. That's why that one's completely liquid. This one's still got a sheet in it. They're different sizes. Basically, they're sheets, of want of a better word, covered in aloe vera oil. So sort of throw that around and have a look. There you go. Pass it around. In all, there. Oh, it took it off here. Good catch. Right. That was straight for the noggin too then, by the way. I was going to get him then. What are these used for? This is your patient with the airway burn, which you need to get going to hospital. The problem is you pull that sheet out, it's like a sheet, and then getting about 16 tubes of aloe vera oil and just spreading it everywhere. It's like jelly wrestling at its best. It's going to cause a massive sort of mess and all that sort of stuff. So, don't use it lots. The other time you're going to use it is if you don't have cool running water. So if you are camping and something like that and someone falls into the fire. So they do have their place, but they're messy as anything. So we don't use them a real lot. Righto. We've now moved. We're in an industrial estate now. Okay? Good. So now again, I'm really going to talk to you about this when we're in your lecture. But this is the palm method of saying a person's palm, and just their palm equates to a 1% burn. We'll talk about this during the lecture. But anyway, you've gone to the industrial area that we saw earlier. In getting there, we realised that we've been called to an exposure burn where old mate has been using ProGlow. What do you do?
Yeah, what is that?
Google what ProGlow is on the way over.
Sorry, what was that?
Google what ProGlow is on the way over.
Thank you. Absolutely. You can't. You come into my lesson for 2 hours without a mobile phone. By the time you leave there, you're fucking doing tricks. Yeah, when you should be using your phone, then why would I use it then? Yeah, absolutely. You're going to Google what ProGlow is. Okay. What else can you do?
Can't you contact someone that usually is like someone you contact for like chemical burns and what you do for each one?
Okay, so you've got a couple of options, and yes, you're right as well. So number one, you can ring up Poison's information and say, this is what's happened, what can I do? Okay, and they may have this on file, and they may have a list of instructions for you to follow as well, which could be a really cool idea. Read the label, absolutely. On any industrial site, there'll also be a material safety data sheet, an MSDS, which if anyone's had the pleasure of ever reading one, it's probably the most god-awful fucking document you're ever going to see in your life. Somewhere near where your student outline sits, yeah? It'll be that much excitement. So, you're probably not going to have a good read of that. But if you can ring people, the other thing that's going to be is if this is an industrial area, there might be a fire warden that has a bit of an idea of what's going on. Let's say that this is an acid powder used to clean stainless steel up after welding, which I don't know what it is, but I used that acid lots in my last life. So, it's really important when we go through and manage this patient, go through and do our ABCs and all that sort of stuff. Does any of those numbers worry anyone at all?
The rest rate's fine.
The heart rate's really high.
The patient agitation.
Yeah, look, you know what? If I put acid on you, I feel as though the agitation level is probably warranted, and the agitation, the pain level is probably what's going to bring up your heart rate and your rest rate too. They're high? Yeah, well, ish?
Yeah.
Ish. 110, 160, fuck, that's high. Do something about that. 110, 22, either either. Yeah, take a look. Righto. Anyway, in a lot of pain, it's still burning. What do you need to do?
Stop burning.
Excellent. How do you do that?
Neutralising the acid somehow, maybe, or washing it off. I'm not sure.
Okay, so, and that's generally speaking when you talk about acids, and let's talk about hydrochloric acid as well in powder form. you would think to yourself the logical thing would be, oh shit, just wash it off. But when you actually add the powder to water, that's when the sizzle starts.
Yeah.
So, follow the directions. You might want to brush it off to start with and then wash away after that. Absolutely.
It'll be on the material safety data sheet as well.
Yeah, if you could be bothered reading that 30-page. It's like I said, I can't get you to read the due dates on my shit, so how are you going to read that? Yeah? Yeah. Right, but yeah, yes, but it will be on there.
Some would just pin up ones as well, so they're easy to read.
Easier, yeah, absolutely. Cool. And then manage the patient. So brush off the whatever it is, take away the exposure, and then stop the burning. So treating your burn, as the same. Anything else we need to do? Probably your fluid replacement and all that sort of stuff as you go, working out your Parkinson's formula for your patient. Is everyone happy with that? Right. So what I've got now for you is, how technical am I today? You'd have to be proud of me. Actually, the distance guys are really proud of me because last night I recorded a lecture for them. Just forgot to turn the fucking volume on, didn't I? So I'll do another one tonight. That'll be fun. Always quicker the second time around. Right. So there's some example questions. Distance guys, I'll pop it on your site for you. If you want to go through them, write those down. I will pop the answers up for you within the next day or so. Okay? Good way of practicing and could be pretty important to you. Happy days? Did you want me to smile for that?
No.
Okay. All right. Cool. So I'm going to take my phone. Bye, everyone.